I'm Dr. Marsha Sonity,
And I'm Dr. Caleb Moore,
and this is the
the
Free
Free
Smiles
Smiles Podcast.
Podcast.
We're talking about the oral systemic connection.
Okay.
Which honestly, this is one thing that I was actually listening to a podcast per usual. I was listening to a podcast and they were talking about like the mind body connection.
Mm-hmm.
And the woman, the doctor that was talking, she's like, we should stop calling it the mind body connection. It's just the body.
Right.
Like, I think it happens because like we specialize and everyone has their own like parts of medicine that
Yep.
we focus on. So then we think about things being all these separate things. But I think dentistry is one of those last frontiers that people are like, oh, it's always been considered separate because, you go to the dentist and that's what they do. They talk about your teeth and then you walk out.
Yep.
So,
And I think
yeah.
there are a lot of people who take huge gaps in their dental visits, like throughout college or maybe in their 30s, they just bought a house and had a couple kids. Or I've even had patients who are like, I am about to start chemotherapy and I need to have a dental visit. They told me I have to have a
Oh yeah,
checkup.
for clearance. That's a big thing with like
Yeah.
joint surgeries. That's a big one.
Mm-hmm.
Which which is almost like just reinforces the whole thing of it's all connected.
Yeah. And they're like, well, in all of those different scenarios, they're like, well, I just have been busy and haven't thought about it. And, oral health has been lowest on the priority. But the reality is there should be so much importance on it,
Mhm.
right? I mean, if you think about it, this is like the one connection, right? I mean, the inside of your arm, your legs, your heart, it's not available to the environment, but your mouth is,
Yep,
right? So
exactly.
it's most susceptible.
Hmm. Yeah, and it's actually a good way to put it is like literally the one thing that that like contacts the outside world all day, every
Yeah.
day. And it's the first point of nutrient absorption into your
Hmm.
body. It's the first point of toxin absorption into your body. It's the first point of like just any kind of contact. It starts in the mouth. And to me, it's like, it's so interesting to learn just over the so many years of just all of the things that just can be affected by your mouth health, that can be affected by, and vice versa, that there's
Right.
signs of certain diseases, a lot of diseases that are early signs. The one thing that I was always kind of surprised by in learning, just about the body was that Lou Gehrig's disease or ALS. One of the first signs for ALS is actually it's I think it's cranial nerve 12, so it's a tongue
Hmm.
movement. So there's early signs if you have issues with tongue movement, that is an early sign of ALS, which hits home because I one of my family members died from that. So that was one thing that always stuck with me of like, oh my gosh, we could be the early diagnosers of that. Not only that, but
Yep.
like leukemia,
Hmm.
different cancers, different. I mean, it's just like the list goes on.
Yeah.
So yeah.
And even something as simple, I mean, we're seeing patients more often than they're seeing primary care doctors.
Yeah.
They go annually for their routine checkups, their labs,
If
just
that, oh my gosh.
if that, right? And
Yeah.
I don't,
I
want
would
to talk
say,
about the last time I had my labs checked,
well,
but
that's true. Yeah. I mean, I'm due. But I would say that's a huge thing too. Like people will come in, yes, it's been 5 years since they've been to the dentist. COVID
hmm
happened. Everyone was kind of out of whack. But then I'm like, okay, when was your last primary care fit? And they're like, oh, 10 years. It's
yeah.
like even more so, especially for like different, like demographics and populations. So I think to us, we're like that kind of reminder. And I am
hmm
big on that. Like when a patient comes in, we're usually checking their blood pressure. We're seeing
Right.
how their just overall body is functioning.
Yeah.
Seeing how they're walking in the door, what their gait looks like, what their just like overall wellness,
hmm
is how they're breathing, how they, all those things are just, it's all in the face. It's all in how we see them.
And it's for me, I was working with an anesthesiologist on a case and we were gonna complete an all in X, right? A full arch, which is a very invasive surgery for a patient. And one of the first things that he asked me was, how did she seem? Like when you
Mhm.
first met her, how did she seem? Like walking into the office, what was she like? Not, personality wise, right? But health wise. So
Mhm.
I think that there should be a lot of, we should stress checking their gait, stress, have they been to the doctor? What is their blood pressure? Having those baselines for me, and I know for you, it's a standard practice of checking it every time. Not just when we're giving anesthetic, but just let's check your blood pressure today, see how you're doing, right?
Yep, exactly. And I think there's also that huge component of like, if someone is like going back to the gait comment of like, if someone is unable to walk very well,
Hmm.
that's also a sign, like inability to walk and just do like normal functional movements like that is a huge decline or like a sign of future decline. So there's
Yep.
cognitive decline with that. There's less vascularity and like, heart health, how is their dexterity? Are they arthritic? Do they have issues with, and that's where like the customization of our job and our hygienist job is to like pick out those things for those patients and say like this is customized care for you
Right.
and what we need to do and what you can do at home to help these things.
Yep.
So I think that's a huge part of us being hygienists for a long time. Like I was always like, hey, what do you do at home every day, or
Right.
what can you do? What's doable? Some people can't hold a regular toothbrush. They
Yep.
need something that's a little bit bigger. Some people are more sensitive to vibrations and things, so they can't use an electric toothbrush because that's like a sensory thing for them. So
Mhm.
I think just getting to know people,
Yeah.
like getting to know your patients as like they function in society, as they are human beings, not just as like a patient in your chair for that hour,
Right.
is a life-changing thing. It's a huge change for that person, or it could be.
And like you said, recommendations will change. For me, I mean, you tell everyone the floss, right? But some people are like, I just can't
Mhm.
manipulate the floss and get back in there. Okay, well, maybe a water pick or a water flosser would be better for
Right.
you, right? So
Find something. Yeah.
it's it's understanding that, okay, well, if you can't complete these things at home, okay, then maybe we need to see you 4 times a year then.
Mhm.
Let's do more frequent cleanings to control the bacteria that's in your mouth, so that way you're not dealing with chronic inflammation. And I would love, for us to get into today, what does that look like, and how can we prevent people from having this buildup of a bacteria profile in their oral cavity, and how does that affect their body?
Yep, exactly. I mean, for me, it always starts with diet. So what are you eating?
Hmm.
Not that I'm a nutritionist, not that I'm giving them nutritional advice, but I'm asking them, what does your day to day look like? How often are you exposing your mouth to acidic things, to high carbohydrate things?
Hmm.
Are you eating frequently throughout the day? Is there a nutritional imbalance there? When was your last blood work done?
Yep.
So that's kind of like the baseline of that, and I think from that information, we can just almost like know exactly where their health is when I'm looking at their mouth. So, yeah.
But I think I agree. I think that looking at their dietary habits is going to give you a lot of insight to how do they function, right? And what are they putting not only their teeth, what are you exposing your teeth to, but also your body to, right? Because, where we're from, it's a chronic issue that people have an inflammatory diet,
Mhm.
which just exacerbates issues systemically and also in their mouth, right?
So whenever I think just understanding that whenever you are introducing not whole, like people think, oh, I'm eating healthy, but then
Hmm.
they're on some kind of weird, like processed, vegan diet where like their food isn't like, maybe you can't, like maybe meat isn't your thing,
Right.
but the things that you're putting into your mouth, maybe they are, not that soy is a bad thing, but like it's a soy-based product that has 20 different ingredients in it, and some of that is sugar. Like, but
Right.
you don't realize that because it's like into that list of 20 ingredients, and if you're eating that throughout the day, that's also gonna like throw off your microbiome. It's gonna increase the risk or the like ramp up state of that bacteria that's gonna be causing more acidity in your mouth,
Mhm.
which not like is gonna create cavities in your teeth, but also like your tissue is not gonna
Right.
be responding to that. There's different kind of like anaerobic bacteria that are just gonna be thriving in that
Yeah.
acid, and then that throws the whole thing out of whack. Yeah.
Yeah, and for me, when I was in hygiene school, our senior year, we had to do like a research thesis, and I went because, kind of like you, my grandpa, he had diabetes, so I had someone really close to me who suffered from type 1 diabetes, this chronic illness. He was never controlled. It was a huge problem, which eventually led to him having a heart attack. And for people to think that wasn't related, well, that's just not the case, right? So
Mhm.
there was chronic, inflammatory markers and cytokines that was caused from the diabetes that then went back to the heart, right? And it's
Mhm.
found in all of those vessels. But the reality is not only does it come from that, it comes from the environment in the mouth too. So a lot of the periodontal bacteria, he didn't see a dentist. I can't recall a time in his life that I saw him go to the dentist. So, not having those checkups and having that buildup of periodontal bacteria, it's now been linked, right? And we've known this for years, but
Oh, for
people
years.
for
Yeah.
years, but people are now just finally realizing that, hey, maybe this is important, right? Maybe I need to, if my gums are bleeding, what is going on there, right? And what's in your gums that can then lead you to Alzheimer's, dementia, heart attack, diabetes, strokes. It's so
Yeah.
important.
Well, that's a huge point. Is like people come in, they're like, "Oh yeah, my gums have always bled,"
Hmm.
and it's like if you were walking around and your hand was always bleeding, you would
Right.
be like, "Oh, something is wrong."
There's an issue.
So your gums aren't supposed to bleed. The reason
Yeah.
why they're bleeding, I mean, you can have a trauma, like you can like
Right.
cut. Like we're taking out that component to it, obviously. Um, the reason why your gums are bleeding is because the bacteria that's getting below your, like there's a space between your tooth and your gum that your bacteria can hide in there. And once it gets or is sitting there for so long, it actually permeates into your tissues.
Yep.
It's actually getting into your tissue, opening up your blood vessels, getting into your blood vessels. I mean, I'm getting this like picture in my head, like it's actually like ripping it open. You get like in a molecular way. It's getting into your blood vessels and it's getting into the rest of your body, which is a huge component of why, heart disease, atherosclerosis.
Yep.
I mean, you can even link it with Alzheimer's now.
Mhm.
There's a huge study that came through OSU, I believe, when we were in school, that linked that. Like the actual like P. gingivalis bacteria was found in the brain, like
Yep.
in those inflammatory states that people are in with Alzheimer's. And like we're all about prevention,
Yeah.
like that's, I think the dental community in general is all about prevention. So if we're coming to your hygienist and they're saying that your gums are bleeding and it's not normal. Like
Mhm.
it might be common for you, but that doesn't mean it's normal and healthy and should be happening.
Yeah, and I think something that you said earlier was being able to communicate with the patient. It's not just the tooth that you're fixing this hour or the ASRP that's in your hygienist chair for the day. You know, some people, they don't want all of this information. They're like, I don't even know what P. gingivalis is. Like, is that French?
Oh, sure.
Like,
Yeah. I don't think I
I'm
would
not,
ever, tell a
yeah.
patient you got P.
Well, no, for sure. But then I have other patients who are like engineers or lab technicians and they want to know all of this.
Very
But
true.
I think it's really important to just break it down for them to be like, this is connected and there is supposed to be a balance of good and bad bacteria. And right now, the bad bacteria is winning. And that's how I always go about it. I'm like, we have to control this. But if they don't see the value in it, then they're going to go, I don't need a deep cleaning. Why do I need a deep cleaning? I've always had regular cleanings and my gums have always been just a little irritated because you just poke at them and floss them really hard,
Yeah. That's a
right?
fun one. But then you look at their radiographs and they have like bone loss and all
Yeah.
that stuff.
So I just
Yeah.
think stressing the importance, and I think, one of the things that I love about what I do is just staying up to date on, the research and the literature and then practicing it. So I am always just like, well, I'm kind of a nerd about this stuff. Like, if you want to know all the information, I can give it to you.
Yep.
But what I find joy in, and I know you do as well, is just knowing what the best practices are. And if there's a new study out on linking, P. gingivalis or FN, or AA to these diseases, being able to share that with patients who might be at risk.
Yeah. Oh, for sure. And I mean, I always think of myself as a healthcare professional as just like a vessel of information. Like we
Mhm.
spend so many hours just studying, learning these research projects,
Yeah.
maybe being part of those research projects, all these things. And I think a lot of that is just we're a plethora of information, and whoever wants to listen
Yeah.
to it, I think there is a nuance to kind of condensing that down into something that's actually digestible for our patients, which I think takes time in our career field to kind of learn that. But I mean, there's any kind of patient that comes in if it's a pregnant patient.
Right.
So, and that's been something, I mean, I feel like I've heard about this for 20 plus years now about, early pregnancy,
Like preterm
birth,
yeah.
low birth weight babies and
Yep.
things like that. I mean, we have a huge, I would say almost like epidemic in the world about fertility issues.
Mm-hmm.
So it's like, yes, that has to do with diet and, environmental factors, but there's a huge component of that when it comes to like inflammation in your mouth.
Yeah.
Yeah. And those bacteria, how you are in general, like your body is now creating a human.
Well,
So it's like, there's so much that is so stressful about that. So let us be the people that can take care of the one aspect so you can,
right.
be healthy and deliver healthy.
Well, it's chronic inflammation. And you're not going to go out and try to run a marathon on an ankle or a knee that's had chronic inflammation for 3 weeks, right? You're like, okay, I need time to
Unless you're
rest. And,
David Goggins.
well, maybe.
Shout out.
And but the point of that is chronic inflammation, it starts in the mouth. And if it's starting somewhere else, it's going to come to the mouth, right? Or
Yep.
if it's in the mouth, it can travel throughout the body and people don't realize that.
Yeah, no, I think that's true. I think the one thing that I tend to like kind of connect things with my patients, maybe just the population I work with, is like gut health. So
Mhm.
like gut health, I think has been kind of a almost like poster child of like, oh, your gut health,
Yeah.
blah blah blah, like that, which is great. I think that's
Activia.
a great thing to yeah, right. What who in the whatever
Is that
people,
Jamie Lee Curtis?
I
Jamie
hope
Lee,
so.
I think it's
'Cause
Jamie Lee
she's
Curtis.
the best.
Like she was in the Activia commercials. Like,
You're right. I think she
yeah.
was.
Anyway,
Yeah,
and
yeah.
so gut health. I even remember when I was like in middle school, like just seeing these commercials.
Activia, which I mean, I think is with sugar and probably not the
But
best. But
anyway,
anyways,
I'm
yeah.
not recommending it. I'm just saying that the trend has been there for gut health.
Right.
Yes.
So the trend of gut health, and I'm thinking like, okay, how am I gonna like let this person almost like create a connection in their mind? Like, oh, I know what gut health is. I know there's good
Yep.
bacteria and bad bacteria in my gut, and I know
Mhm.
what colon cancer is. And I'm like, okay, well, your mouth is like the beginning of that tube.
Yep.
You know?
Right. It's
Which
the
it
start.
really is. Like we're just like a tube inside of
Exactly.
us that
Right.
we are trying to keep healthy, because that's really the starting of everything
Yeah.
when it comes to our health. So
Yeah, and I
yeah.
think too, for some people, it's really one of the most challenging things that I think that I deal with, as a dentist is being able to not being able to read people. I do that very well, but being relatable, right? Because some
Mhm.
people they're like, well, I don't care. I got like some people literally don't care. They just
Mhm.
and you can't get through to them, but it's like, but they care about how white their teeth are, or they care about what their smile looks like. And so being able to relate it back of if you have all of this bacteria, it's going to allow for you to get increased staining, right? Food is going to stick easier to these areas,
Mhm.
or it's going to cause cavities, which then will darken your teeth or cause decay. So I think it's really important that, as providers, we use this as a foundation because you can stem it any which way, gut health or heart health or
Oh
even
yeah.
cosmetics. Like this is the foundation because like you said earlier, it's not just a mouth, it's not just the
Mhm.
oral cavity. It's not a mind body connection or an oral systemic connection as they call it. It's we're one being,
It's the whole
right?
thing. Yeah,
Yeah.
exactly. That's the whole thing, is like it's everything we, what you put in your mouth, how that's digested, all those things are, relating to our body. And I mean, inflammation, I think at this point everyone knows what inflammation is.
Right.
We just went through a pandemic where I think a lot of society is kind of waking up to, oh, we're
Mm.
not healthy.
No.
But I mean, mental health. So let's talk about like that aspect of, your confidence, how you
Hmm.
feel every day. I mean, we have patients that come in every single day and they're like, how do I make my teeth whiter? I mean, yes, that's like a very simple request, but
Right.
it's because they want to be able to smile in photos. They want to be able to take their grandkids and their grandkids not say, "Oh, Nana, why are your teeth yellow?" I feel
Yeah.
like I have so many of my older patients that are like, "Well, my grandkids have no filter. How do I get my teeth whiter?" Because they're saying this. So it's not about that, like the vanity of it. It's
Yeah.
about like the confidence that comes with walking into a room, being able to like smile. Like our facial connections with one another is such a huge
Yeah.
component of being human that it's not about like, it's about that next job interview that you
Right.
have, or it's about, yeah, like whatever it may be, like your oral health and how you present yourself and wanting to smile.
Hmm.
Like that is such a rewarding, I mean, just a rewarding part of our career.
And I love that you brought that up because, we can sit here and harp on heart disease, diabetes, and everyone has at least heard about this from their dentist, like, oh, you need to stay healthy.
Yep.
But the reality is there's another form of health, which is mental health, and our smile and our confidence is directly related to that. And one thing that you and I experienced firsthand was when we went to the Dominican,
Oh yeah.
right? And we did our humanitarian trip, and the thing that they were concerned the most about was their smile, right? They
Mhm.
wanted to fix their front teeth so they could get jobs, so they could have relationships with people. And it was a huge thing in that community because what was it? Sugarcane? Yeah, like
Oh yeah, yeah, sugar canes.
they
Like they
just
just eat it
eat.
as kids, just chomp
Yeah.
on it.
So I think that was eye opening to me that these people need their smile and they need to look good when they smile and talk so they can be able to work and be a part of society.
Well, yeah, because I mean that is, I mean that's, I think that's present here too. Like,
It is, yeah.
but it's a huge component there. Like to them, a lot of the job availability and actually getting a good paying job is getting, hired on one of the resorts or one of those,
Yep.
like a restaurant or some kind of like facing, the public kind of a position, and they won't hire them if they don't have, some
Right.
kind of like, nicer appearance, or they kind of look put together,
Yep.
they can smile, or all those things are, that may sound like it's a discriminatory thing, but if you think about it, if you walk into some place and you have, you're greeted by someone who isn't looking well,
Right. They're
like
missing
it
a few
just,
teeth. Yeah.
yeah,
Like,
it creates a very different response, especially if you're in like a guest service type of a thing. So,
mhm.
um, I think just putting all of it together, I just really think that there's such a, I mean, there's an untreated, population, I think everywhere in the world, but I think there's so many people in this country that just would benefit so much just from something so simple like preventative care, simple
Yeah.
things they can do at home.
Well, I totally agree. And I think that we've given a lot of insight to oral systemic connection and how it's all one, right? Um, I would love to focus more on our next episode on how we're practicing that clinically from a holistic approach.
Yep, all about holistic dentistry.
All right, let's do it.
Thank you so much for listening. If you enjoyed this episode, please share it with a friend. Don't forget to leave us a comment, rate us, and subscribe so you never miss an episode. We appreciate your support and look forward to bringing you more great content.